Live, this is Fox News Midday.
Well, it is allergy season and it is hard and impossible for some to avoid. Right now, the oak tree is causing all kinds of issues, but if it's not that, it's mountain cedar, mold, grass, ragweed, milkweed, whatever that one is. I mean, the list goes on. So what can we do? Well, allergist and immunologist from University Health, Dr. Chioma Udemgba, joining us now for a little look into all these issues. Welcome to the show.
Thank you for having me.
Absolutely. You know, I struggle with allergies. I'm still trying to get my voice back because of the oak, but also when anyone moves here, I tend to warn them. Even if you've never had problems with allergies, you very well could here. So what's kind of the root of all of this? Who's more susceptible if that is a situation?
Yeah, so I have a lot of job security here in Central Texas because that is the big problem that a lot of people face. There really isn't a great reason for why. That sometimes family history, you can identify that, okay, my mom, my sister, that puts you at a higher risk, but there isn't really a great reason as to why somebody has allergies. But you are a little bit special because your immune system just decided one day that that cat dander that you see all the time or that oak or cedar pollen is a problem, and it will attack it in the same way that it will attack a virus or bacteria. And that's why you get the similar symptoms as you would a typical kind of cold or virus.
Right. So what's a good plan of attack for people who know that they're going to have issues?
Yeah, so there's typically a trend. So some people who have seasonal allergies, you'll know what time of year is typically a big problem for you. Here with our cedar fever, that's typically we're going to be at the end of the year, so October, November, but there's another big peak between February and we're seeing here now as well in April when the oak starts to populate as well. So if you know what time of year is going to be a problem for you, I typically recommend somewhere between 2 to 4 weeks before that season to go ahead and start taking your allergy medications and getting yourself prepared so that you can bring down your inflammation level so that you're not suffering the entire allergy season.
Okay, so maybe set an alert on your phone, everyone, 2 to 4 weeks ahead of time. And then, you mentioned that the body fights it in a similar way that it does a virus. So we always have this issue, the seasons change, the allergens kick up, and it's at the same time as cold and whatnot. So how do you know the difference between allergies and the cold, flu, COVID?
Yeah, it can be really difficult. It is called hay fever for a reason. So you do have a lot of the same features with an allergy flare as you would a virus or a bacterial infection. But some of the key distinctions are going to be when you have really bad allergies, itch is going to be a big feature. So you have really itchy eyes, your nose is really itchy. And then some of the timing parts of it are going to be different. So if you caught a virus or a cold from somebody, typically other people in your household are going to be sick. But when it comes to allergies, it's very uncommon for multiple people to be affected at the same time. Okay. And then it really is truly, you'll have a low grade fever, so something 100.4 or 100 point something. 101, 102, 103 fevers, that's more infection, that's more virus or bacteria.
Okay. Well, thank you. That's such great information. Thanks for coming in today. But Dr. Chioma Udemgba with University Health, always good information to have. Thanks for coming in.
Thank you again for having me.
Absolutely, and we'll be right back.